My name is Dr. Lori Sutherland. I am an anesthesiologist with Spectrum Medical Group and a member of the anesthesia team caring for patients on labor and delivery. This team is comprised of 3 types of anesthesia care providers: attending anesthesiologists like me, resident anesthesiologists, and nurse anesthetists. I'd like to talk to you about epidural anesthesia that we provide for pain relief during labor. To help me with this are Dr. Stephanie Nessman, a resident anesthesiologist, and Jonathan Bradstreet, one of our nurse anesthetists. You may see 1, 2, or all 3 types of anesthesia care providers during your labor and delivery. Most frequently, an epidural is inserted by either a resident or nurse anesthetist under the direct observation of one of the attending anesthesiologists.
An epidural is performed by placing a small, hollow tube called a catheter in the epidural space, which is just outside the spinal canal. Prior to inserting the needle used in this process, we will numb the area with local anesthetic or numbing medicine, similar to what you may have received at the dentist's office.
Once the needle is in the correct location, a catheter is inserted through the needle and anesthetic medicine is injected to relieve pain during labor. When the catheter is placed in your back, you can expect some small stinging with the local anesthetic and then deeper pressure.
On some occasions, despite our best efforts, you could have some sharp pain after this. If this happens, we will give you more numbing medication and make you as comfortable as possible. In most cases, once we have numbed the area, the catheter will be in place within 10 minutes or so. In some occasions, this can take longer, especially if you have an unusual curvature of your spine, such as scoliosis, or if there is a lot of tissue between your skin and the bones of your lower back.
You can check yourself for this by reaching around to your lower back and feeling for the bony bumps in the middle of your back. If you can't feel these little bony bumps in your lower back, there is a distinct possibility your catheter placement may be difficult. We know how uncomfortable you are during your labor and will work as quickly as we can, but despite having excellent providers, this sometimes can take as long as 20 minutes or more and may require more than one attempt by more than one provider.
Once the catheter is in position and we inject medication through it, we expect to see reduction in pain in 5 to 10 minutes. So if all goes well, we hope that you will feel better in 20 to 30 minutes from the time we start placing the catheter.
Sometimes, despite what appears to be excellent placement of the catheter, it fails to function properly. There are numerous reasons for this, including being the result of a nearby blood vessel washing the medicine away. We have no definite way of knowing if this will occur until we try the catheter.
If this happens to you, we will remove the catheter and replace it. This will obviously delay your relief, and we apologize for that. If the catheter functions well, we give you medicine to attempt to reduce your labor pains to a tolerable level. This is the ideal balance between safety for you and your baby and comfort.
Trying to get complete relief in every case is not ideal. We and your labor nurse will work with you to get the right balance. An epidural can provide relief for many hours. However, the longer it is used, the more likely it will lose its effectiveness. If during your labor your pain becomes unacceptable, your labor nurse will contact us and we will return to your room and make adjustments to your epidural to improve your relief.
Sometimes this is as simple as adding more medication. Other times, we have to adjust the catheter location, and in some cases, we may even have to remove and replace the catheter completely.
This is a good sign that you're about to deliver. Sometimes your obstetrician will have your epidural turned off to help you push more effectively. This, of course, can increase your pain, but is also likely to help you deliver your baby sooner. If your pain becomes intolerable, your nurse or obstetrician can contact us, and we will restart the epidural infusion for you.
We hope this description has been helpful for you. We will also review a detailed description of the procedure at the time your epidural is placed.
And you can ask any questions you like at that point or any time during your labor that we have not answered here.
Congratulations on your pregnancy, and we hope we can assist you in having a great labor experience.